sharing my screen. Hello, everybody. Hope you are having a wonderful um, evening, Sunday evening. We are playing Kahoot. First things first. Now, I won't tell you the age of Nadia yet, but I will tell you that this section is about um, insurance and having your first child. All right, everybody is in. So the first question, at what age do you need to buy your own insurance? Okay, so the age that you have to buy your own insurance is 26. Until then, you are kind of covered under your parents' plan. So yeah. So true or false, the average age to have your first child in the US is around 26. It is true. It is significantly lower than other countries, which are around 30. The US is around 26.4. Nice job. So which of these companies is the largest health insurance company? So it is United Healthcare, but the four of these companies are all huge. They all make up about 40 to 50% of the privatized healthcare market, which is basically like they run a monopoly. Brooke, all right. So how much would a pregnancy operation just cost for an uninsured woman? Okay, so this is interesting, but if you have no complications and you don't have a C-section, it's 30,000 to 35,000 out of pocket, which is exorbitant. But if you do have a C-section, it is 20K more. It is a lot of money. Trey is killing it. So what nutrient is important during pregnancy? It was a trick question. All of these are super important, but you all are winners. So yeah, that is pretty much just kind of like interesting things that I found in my research that I just didn't know before kind of doing this presentation. So yeah, so now I can tell you our main character, Nadia, she is 26. And at this time, she has hopped off of her parents' insurance plan at the same time as her pregnancy test came back positive. So she wants to know, what insurance plans can I get, and what kind of, purchases and expenditures will I need to prepare for. So just to kind of lay the basic terms out, there's premium, and a premium is the amount of money you'll give to an insurance company monthly in order to make sure that you continue to be covered by them. And then there's out-of-pocket expenditures. So there's a copay. Copay is basically just the money you'd pay for every visit that you go to the physician. Usually it ranges from $25 to $50. And then there's in-network coinsurance. This is for like bigger procedures like surgery, but the insurance company will pay a percentage of that medical bill, and then it will be up to you. So for our case, Nadia would have to pay the rest of that percentage. Yeah. So these are full hypotheticals, but let's say she's under Medicaid. For Medicaid, you would have to qualify for it. So let's say she's in Maryland, and she has a combined salary of 40,000 or less. She would qualify for Medicaid, and she would get year-round coverage, and she would pay little to none for maternity expenses, which is great. But let's say she doesn't make a combined salary of under 40,000. Let's say she's in a company which, as a benefit for their employees, allows her to be a part of United Healthcare. She would still have to pay deductibles to have like the insurance company start paying for her maternity expenses. The way deductibles work is, let's say you have medical bills, you have to pay the insurance company some money, and then the insurance money starts paying for your medical bills, which I think is really weird. And Finland, so let's say she's a citizen of Finland for some reason. They have the lowest mother mortality rates over there, and she would have to pay around 60 euros for the entire procedure. Mothers and babies also have free checkups and daycare costs under 100 euros per week. And all this is thanks to like great tax laws and also the rich being like less like strict about paying more money. I think that's kind of cool in my opinion. Um, but maternity expenses that she would have to prepare for include prenatal vitamins. So these are just the main ones listed, but it's not like a booster. You can't just have it like one time. You have to continue having these vitamins every day. So it can get very pricey. And maternity resources like cribs, diapers, car seats, these things need to be considered. And then maternity leave, there's no federal act that says that companies need to pay maternity leave, which I think is also really stupid, and they need to work on that. Um, but there are ways to reduce maternity cost. So just a TLDR, you need to make sure that you talk with your insurance company about what is covered, what is not covered, and how much my out-of-pocket pay will be or costs will be. There's something called HMO plans, which is basically when you say, I'm going to commit to a certain doctor or a certain hospital to do all of my pregnancy tests and operation. You pay a lot less out of pocket, but there is more copay. And then I think it's important to be questioning doctors. Do I need to have this expensive test done? Are there any other alternatives? And then timing it right. I think this is stupid, but they say that if you do pregnancy in 1 year, let's say um, you get pregnant in January or February of 2019, and then you have the operation in 2019 itself, you only have to pay deductibles once. If you have it across 2019 and 2020, you pay deductibles twice, so you will save a lot more money if you time it right. And then under the Affordable Care Act, there are health services that are free, including breast pumps and lactation counseling after childbirth. So I think it's important to make sure that the resources that are accessible to the community is kind of just, I guess, in our minds, I guess. Yeah, just being aware about it. Any questions, concerns, comments? Hopefully you all learned something new today. I know I definitely did. I guess I'll stop sharing now. But yeah, just let me know whenever the 1 minute timer is there because I really can't see that. But yeah. Anybody do anything crazy for Halloween? Nope. That's cool. That's cool.
How about you? How's your Halloween?
It was okay. I watched the movie Us for the first time, which I hadn't watched it. I had watched Get Out, and I've watched that a bunch of times because I loved it. I thought Us was definitely along a more serious tone in terms of, and a lot of the themes that they displayed were interesting. I thought it was kind of cool that they were like two parts of the same body, and that the government tried to like exploit one part to control the other part. I think it really got into some homelessness type of things. Oh, all breakout rooms are closing in a minute. Well, I guess I guess that's it for the meeting. But yeah, see you guys. I'll see you guys in the main breakout room.